share Andre's story. It all began on Friday the 13th, a typical day in a busy home with 5 children. A simple question that Andre asked his dad that morning changed everything. By that evening, Andre and his family became a children's family and were immersed in uncharted territory. Please join me, first of all, in welcoming Andre, who is here, Andre's mother, Amy, Andre's grandmother, Renee, to share Andre's story.
Wow, I can hardly take it in that it's me and my amazingly courageous 11-year-old son here with you guys today. Of course, there's an element of feeling woefully inadequate to be speaking to a room full of so many influential women and men. Women and men whose ideas, decisions, and ultimately management skills have an impact on so many lives of people that you'll likely never even meet, or names you may never even hear of. Speaking before such an audience is an honor, and I don't look lightly on it, but it's not why I can hardly take this day in. The real reason I'm a bit incredulous as I stand here before all of you today is because I can still hardly take in the journey of the past 18 months. As Joy already said, our journey to this moment began around 7 a.m. on Thursday, September 12th, 2013. It was a typical morning in our townhouse as our 5 kids jockeyed for use of one of the 2 bathrooms in our cramped temporary living arrangement as we built our new house a few miles away. That typical morning became atypical when Andre came out of the bathroom and asked my husband if everyone has this lump in their stomach. Unbeknownst to us, Andre had been noticing this lump for the previous 3 months. You couldn't just see the lump when you looked at him. I mean, we had just finished summer and he had had his shirt off pretty much the whole summer long. And not once had I ever looked at him and thought he had a softball-sized tumor in his stomach. Andre had always been a very active kid. He has a passion for baseball, swimming, hanging out with his friends, and engaging in pretty much any sport you can think of. Andre showed no signs of being sick. Yes, he had frequently complained of headaches and stomach aches, but what kid doesn't? And you can't just take a kid to the doctor and say, "Can you see if he possibly has a tumor in his kidney? He's got a stomach ache." So when my husband came to me and suggested that I bring Andre to the doctor that morning, I made the appointment, but I really wasn't concerned because when my husband had said lump in his stomach, I, for some reason, thought of hernia, and I wasn't thinking cancer. So I figured it wasn't a big deal at all and made the appointment. When the nurse practitioner performed Andre's exam that morning, she kindly agreed that it could be a hernia, but that she'd just confirm it with the CT scan. Of course, in hindsight, I realized that his nurse practitioner knew that it wasn't a hernia. And I realize this now because she had ordered blood work, and that morning I thought it was weird that she had ordered blood work, but I figured it was some sort of weird protocol before a CT scan that she needed blood work, but I couldn't figure out what you'd be looking at the blood for a hernia for. Soon after I left the clinic that morning, the hospital called to schedule a CT scan. Again, I was surprised that they were putting such urgency on getting the CT scan scheduled for a possible hernia. But if they wanted to do it at 5 p.m. on a Friday evening, then I was fine with that. The next morning, the clinic called to tell me that all of Andre's labs came back normal, and I thought to myself, well, of course they did. What did you expect to find with a hernia? But that evening, during Andre's CT scan, the CT technician asked if we could just hang around for a little bit longer because he needed to call the clinic just to see if they needed some additional pictures before he let us go. Well, of course, the CT technician knew that he was going to need more pictures. He knew what he had already seen in his first round of pictures, that Andre had a large tumor in his left kidney, but I still didn't have a clue. I finally got a clue when my cell phone rang around 8 p.m. that Friday night. I had just arrived at the football field to watch my daughter dance at the halftime show and was running a bit late, so I wasn't going to answer my ringing phone until I saw that it was the clinic calling. And again, I thought it was strange that the clinic would be calling to follow up on a CT scan for hernia at 8 p.m. on a Friday night. But I figured if they were going to take the time to call, I better answer the phone. It was a female doctor who happened to be on call for the clinic that night, and I'm somewhat ashamed to say that I don't even remember her name. But all I know is that she was very kind as she relayed the information to me. She told me that they had found a tumor in Andre's left kidney that was approximately 10 centimeters big. And she quickly informed me that she had already been in touch with the specialist at Children's Hospital in Minneapolis about Andre. And she spoke confidently as she assured me that we would be in the best hands down there. And it was with that phone call at a hospital that I had never given a second thought to. A hospital that had indirectly been preparing for this very kind of day suddenly became very, very, very important to me and to my family. Suddenly, decisions made by executive boards and management in the years, months, and days prior were going to have a direct impact on me and on my son and on our family as we set off on a journey into uncharted territory for us. Although this journey was into uncharted territory for our family, I'm so thankful that it was not uncharted territory for the doctors, nurses, and staff at Children's Hospital in Minneapolis. I'm glad that for solid tumor doctors at Children's Hematology and Oncology Clinic, doctors like Dr. Rawas, that our journey wasn't uncharted territory for him and his colleagues. Instead of being apprehensive and scared as we took in terms that we had never heard of and concepts we had never stopped to consider, we were able to take in the information calmly and with a level head, thanks to Dr. Rawas's expertise and presence. And with his patient demeanor, he worked with us and confidently guided us through Andre's care, proving to us that our doctor's words that Friday the 13th were true, that we were in the hands of the best specialists because we were there at Children's Hospital in Minneapolis. I'm also glad that for nurses like Teresa and Mark on the 7th floor, that taking care of Andre before, during, and after his surgery wasn't uncharted territory. With their love, care, skill, and sense of humor, they guided Andre through what could have been an otherwise scary and painful week and a half. Instead of looking back on his hospital stay with sadness, Andre actually looks back on it with a smile as he recounts things like his bed being raised as high as possible to what he came to call Mark height. Mark is a very tall nurse on the 7th floor, and so he would raise the bed as high as possible to tend to Andre. And Andre loved the bed rides, even if it was 3 in the morning for Mark to check his vitals. I look back on Andre's time in the hospital with a smile too, as I recall Teresa, a fabulous, kind, and caring nurse who was one of our favorites, often asking Andre if he had understood what the doctors had just told him. And then she'd usually break down the words and the loads of information into something smaller that Andre could understand. I'm glad that it wasn't uncharted territory for guys like Elliot and the agents at the Geek Squad, who always treated Andre like he was a rock star every time he would come in to pick out a game or a movie. I'm glad that it wasn't I'm thankful too that someone in the previous years had even conceptualized having the Geek Squad precinct on site there at Children's Hospital, and that management for both organizations had done what needed to be done to make that arrangement a reality in November 2009. Although video games and movies are not the ideal thing for kids to spend hours on under normal circumstances, for a 10-year-old boy going through cancer treatment, having the Xbox, the games, and the movies, and the Geek Squad staff there on site at Children's played a huge part in making Andre's stay and subsequent chemo treatments far more enjoyable for him. Not only did the entertainment provide a much-needed distraction from the pain of surgery and chemo, it also provided a feeling of normalcy for him and his friends when his friends would come to visit. This was especially helpful in the beginning when his dear friends, who were already struggling to comprehend what Andre was going through, would visit him. And although Andre anxiously anticipated his first visitors following his surgery, the visits often began a bit awkwardly as these young 10-year-old boys stared wide-eyed at the tubes and equipment everywhere in the room, and they weren't sure what to say to Andre. But when the kids were able to get the Xbox controllers and start playing games with Andre as he laid there in bed, then suddenly they could relax, laugh, and reconnect over their video games. When that happened, things could feel somewhat normal in the room again. And even if it was just for an hour here and there throughout his stay, those hours here and there were hours that we did not spend focusing on our drastically changing lives. Then when Andre began his chemo treatments and we realized how much giving him fluids with his treatments helped with his nausea, his appointments became hours long instead of just a few minutes. But the highlight of the appointment was always our stop at the Geek Squad, right when you walk in the door from the parking lot. And although Andre hated the sickness he would ultimately feel in the days following his chemo, he actually looked forward to the appointments themselves because we got to visit the Geek Squad. Amazingly enough, the Geek Squad wasn't the only awesome resource that helped Andre get through his treatments. Sam and Jody, the child life specialists in clinic, were also a great help. Yet again, I was glad that our family's journey wasn't uncharted territory for either of these great ladies. From their assistance in explaining complicated things to Andre in the clinic, and to his classmates at school, to the opportunities for outings for the family, to twins and wild games, to simply their warm greeting and care whenever we were in clinic, they played a big role in helping to take Andre's mind off of his health concerns at hand. And while Sam and Jody were helping to ease Andre's mind, I was very thankful for the social worker, Teresa Huntley, who was helping to ease my mind too. And I can't tell you how much it helped as Teresa walked us through the process of getting assistance for hospital parking and meals, a mortgage payment, and a family weekend away through Miracles of Mitch Foundation, a gift card from Blair's Tree of Hope, and ultimately helping us get started on Andre's Make-A-Wish. I really can't quantify for you all what being able to dream of a wish did to help Andre through his treatment. The benefits of Make-A-Wish didn't start on August 20th, 2014, when our family left for Italy on Andre's Make-A-Wish trip, which was ultimately a cruise to Greece. But the benefits started that day at one of Andre's first clinic appointments, when Teresa visited us in the room and told Andre that he could likely get a wish granted. And in essence, Teresa handed Andre a get-out-of-jail-free card that day when she told him to start dreaming about what he would like to wish for. Of course, we never would have felt so comfortable in our uncharted territories had it not been for Andre's wonderful nurse care manager, Christine Johnston. The level of care Christine gave Andre at each appointment, or each week when we were in clinic, was simply proof that our experience was not uncharted territory for dear Christine. Like Dr. Rawas, Christine had an equally calm and gentle demeanor that quelled any anxiety that Andre might have otherwise had at his weekly appointments. She was the calm consistency that gave us weekly assurance as the unknown became well known to us. And last, but certainly not least, I have to mention how absolutely phenomenal children's psychologist Sherry Kam is. I wish I could put into words for all of you how amazing this woman really is. Andre has a beautiful, beautiful smile. Yes, I realize I'm a bit biased here. But truly, Andre's smile seems to emanate from his eyes and perfect itself in his upturned lips. And as hard as it was to see happen, after months of adjusting to his new circumstances, Andre had begun to somewhat lose that beautiful, beautiful smile, and it was heartbreaking to see. But then we remembered sweet Sherry Kam, who had visited Andre in his first days in the hospital. She had talked about being there as a resource for him should he ever feel like he just wanted to talk about the good, the bad, and the ugly of what he was going through. Although Andre didn't feel the need to talk with Sherry in the first days and weeks of his journey, there came the day when he did need her, and she was amazing. She would break out the modeling clay or the Uno cards, two of Andre's favorite activities, and she would be this amazing outlet for him without him even realizing it, per se. Just having that outlet was all he needed to get his beautiful smile back once more. Well, okay, so maybe finishing chemo helped with that too. But Sherry is still amazing. Although you really can't say there's a good kind of cancer to have. In the scheme of cancers, Andre got one of the more curable cancers. And we celebrated when the pathology report came back as Wilms with favorable tumor tissue, which meant a prognosis of 99% compared to the 15% that we were looking at with the other possible form. With a relatively short chemo roadmap ahead of us, I still will never forget Andre's first chemo treatment on Friday, September 27th, 2013. There was a little boy handing out sock monkeys that day, and they were to celebrate the fact that he was socking it to cancer with his No More Chemo Day. That was our introduction to the significance of the long-awaited No More Chemo Days for kids going through treatment. Andre's No More Chemo Day was January 31st, 2014, 18 weeks after his first chemo treatment. With a few of his close friends, his brother, and his grandpa and grandma all packed into the room, we celebrated as Christine injected Andre's final chemo into his port catheter. Of course, Andre had the typical post-chemo days for a few weeks following his treatment, but by the beginning of April, when his baseball season began again, he looked just like the kid who had walked off the diamond the previous August. If someone hadn't told you Andre's story, you wouldn't have ever known that in his off season, he had knocked his cancer out of the park and bravely charted unknown territory thanks to some amazing people in the Children's Hospital and Clinic Network who guided him all along his journey. So before I leave you all to your afternoon activities, I want to thank each of you for your part in building a network of support that is focused on patient and family comfort to guide unsuspecting families like ours through the uncharted territories of cancer and so many other serious illnesses and traumas. For those of us that receive phone calls that bring our normal lives to a screeching halt and suddenly catapult us into the unknown, we thank you for your efforts. To put in to chart these territories out so that we can be at ease during a time at which it would otherwise have been very difficult to be at ease in. So from Andre, our family, and myself, we thank you for helping us to have the courage to lose sight of the shore so that we could discover new oceans in our journey through life.
much, Amy and Andre and the Beasley family, for being here today. It's very special for us. Once in a while, just occasionally, sometimes the job seems to get the best of you and you're having a rough day or a rough week, and you sort of wonder about our mission and why we're here. We're here for you. And if you ever need a reminder of why we exist and why we do what we do, all you have to do is look at Andre and look at the Beasley family. And it's very kind of you to give your time and come down here today and give such an uplifting presentation to us, and we appreciate it. Thank you.